Today, we're delving into a topic that's probably crossed your mind: back pain. Have you ever wondered about the types of back pain or what might be causing that nagging ache? Well, let's explore the world of back pain together. I'm curious, have you experienced back pain, and what questions do you have about it? Share your thoughts in the comments below, and let's have a chat about this common concern. Meet Sarah, a vibrant and healthy person working in a bustling office. Lately, though, her back started acting up, causing discomfort that she couldn't ignore. Concerned, she decided to seek help from a specialist. At the doctor's office, Sarah underwent blood tests and scans, including a bone scan. The anticipation in the room was palpable as she anxiously awaited the results. Finally, the moment arrived, and the doctor shared the news: Sarah had back pain related to disc bulging. Feeling a mix of emotions, Sarah turned to the specialist, seeking understanding about her condition. In a caring and easy-to-understand manner, the doctor explained that disc bulging occurs when the soft cushions between the spinal vertebrae push outwards. It was causing her back pain, and Sarah wanted to know more. The specialist reassured her. Pain in your back can be an annoying ache, or it can get so bad that it's unbearable. Back pain is the second most common reason why people visit their healthcare providers, just after colds. Many people miss work because of it. Around 80% to 90% of people will have back pain at some point in their lives. Back pain is categorized in a number of ways by medical professionals. You can describe your back pain by its location: upper, middle, or lower back pain that's on the left side, center, or right side. You may also define different types of pain to your healthcare provider. Is your pain mild, moderate, or severe? Is the pain a broad ache or a small or sharp stab? Also, back pain can be categorized by how long it lasts. An acute episode is one that is sudden and brief, and often related to an injury. Chronic/persistent means your back pain has lasted more than 3 to 6 months. Back pain is very common. The older you are, the more likely you are to experience back pain. You're also at a higher risk if you don't exercise, already have some types of cancer or arthritis, are overweight, lift using your back instead of your legs, have anxiety or depression, or smoke or use other tobacco products. There are causes of local back pain: pain in your spine, muscles, and other tissues in your back, and then there are causes of radiating back pain, pain from a problem in an organ that spreads to or feels like it's in your back. Examples of both include local back pain. Back pain in your spine may be caused by ankylosing spondylitis, arthritis, degenerative spondylolisthesis, intervertebral disc degeneration, radiculopathy, sacroiliac joint dysfunction, spinal disc degeneration, spinal stenosis, spondylolisthesis, trauma/injury, tumor. Back pain localized in your tissues may be caused by sprain of a ligament, a strain of a muscle. Radiating back pain may be caused by abdominal aortic aneurysms, appendicitis, cancers, very rare, fibromyalgia and myofascial pain syndrome, infections, very rare, gallbladder inflammation, kidney infection and kidney stones, liver problems, pancreatitis, pelvic inflammatory diseases, sexually transmitted infections, perforating stomach ulcers, urinary tract infections. In women, radiating back pain may be caused by endometriosis, pregnancy, uterine fibroids. In men, radiating back pain may be caused by testicular injury or torsion. Back pain can last a day, a few weeks, months, or a lifetime. The length of time depends on the cause and the treatment. It can be. Many people who are pregnant experience back pain. It's extremely rare, only about 1% of the time will back pain be a sign of cancer. In many cases, your healthcare provider may get all the information they need from interviewing you about your symptoms, health history, and lifestyle, and then doing an exam. However, sometimes image tests are necessary. Your primary healthcare provider is often able to determine the cause and diagnose your back pain. If needed, they'll send you to a specialist or order tests. Your healthcare provider will ask if you injured yourself, how long you've had back pain, and how severe your pain is. They need to know other medical problems you have and what medications you take. If you have family members who have had similar issues, let your provider know. This depends on the cause of your back pain. If your pain is caused by an infection, for example, it might go away after the course of antibiotic is complete. If your pain is caused by spinal degeneration, you may need treatment through your lifetime. The cause of your back pain determines the treatment. For your back pain, you may feel better with cold packs and or heating pads, stretching exercises, massages, surgery, antibiotics, cortisone, traction, physical therapy, other over-the-counter and prescribed muscle relaxants, steroids and pain medications, exercise, specifically strengthening exercises, chiropractic care, acupuncture. If you had an acute injury, use a cold pack for 20 to 30 minutes at a time for the first 48 hours or so. After that, or if there was no acute injury, you may find it helps more to alternate a cold pack and a heating pad. Keep one on the area for 20 to 30 minutes, and then switch. Take over-the-counter pain medications like ibuprofen. Get plenty of rest and fluids. It may feel most comfortable to sleep on your back with a pillow under your knees to relieve pressure on your back. If this isn't comfortable for you, try sleeping on your side with a pillow between your knees. Avoid sleeping on your stomach. Possible ways to reduce your risk of back pain include: learn to lift with your legs, not your back muscles, exercise, maintain a healthy weight, don't slouch. Keep your back straight when you stand and sit. Stop smoking and using tobacco products. Get help for stress, anxiety and depression. Wear low-heeled shoes. Stretch regularly. Back pain may go away on its own in some cases, but it's best to get treatment, especially if you don't know the cause. Talk to your healthcare provider about a timeline regarding when you can get back to daily activities. Yes, muscles and bones can get sore again. See your healthcare provider about your back pain if it's severe or doesn't get better after a few weeks. See them immediately if you feel weakness in your legs, you feel numbness or tingling in your legs, genitals, buttocks or anus, you're losing weight, not on purpose, there's swelling in your back, the pain spreads down one or both of your legs. See your provider again as soon as possible if you now have back pain plus blood or pus in your poop, fever, urine, pee, that is bloody or cloudy, if it smells bad or if peeing is painful, groin pain, vomiting, nausea, pain during or after sex, irregular periods, abdominal pain. As Sarah embarked on her journey to manage back pain related to disc bulging, she carried with her the reassurance of a caring healthcare specialist. Armed with knowledge and a personalized treatment plan, she left the doctor's office, ready to take proactive steps toward a pain-free life. With the support of her medical team, Sarah understood that her well-being was a priority, and she felt empowered to face the challenges ahead. The story of Sarah's experience serves as a reminder that, with the right guidance and care, one can navigate health concerns with resilience and optimism. As we conclude our discussion on back pain, let's prioritize your well-being. If you've experienced back pain or gained insights from our conversation, why not subscribe for more health insights? Remember, your body communicates its needs, so pay attention, seek assistance when required, and be open to lifestyle adjustments. While back pain may persist, adopting the right strategies can help you effectively manage it. We appreciate your presence in our health community. Don't forget to hit subscribe button. Wishing you a journey ahead filled with comfort and well-being.